Okay, so today's topic is a condition called endocardiosis. Sorry, I'm starting to realise that these aren't going to be kind of 2-minute videos. They are going to be a little bit longer, but I think the information is actually quite important. So endocardiosis, it's quite a common problem that we see, particularly in Cavalier King Charles Spaniels. This is the condition that causes their heart murmur that's quite often picked up, and we actually find most Cavaliers at some point in their life will develop this condition, endocardiosis. So basically endocardiosis is a shrivelling of the heart valves, and the way to really think of it is the valves are a bit of a one-way system. So basically what will happen is as the heart contracts, blood will flow through the valves, and then they close off as the contraction stops, because back pressure basically pushes against the valve. What happens with this condition called endocardiosis, which we don't fully understand quite why it happens, but these valves begin to shrivel, and so instead of meeting perfectly here in the middle, what we start to get is we get a gap. And so when the heart relaxes, the pressure in the blood vessel actually pushes blood back up, and we find we actually start to get a bit of a backflow, and that backflow is what causes the heart murmur. So it creates a bit of turbulence as it goes through, and we end up with kind of a murmur that we can hear. Now, generally, the loudness of the murmur doesn't perfectly correlate with how bad the leak is, but there is a pretty close correlation. So generally, the louder the murmur, the worse the leak will be. So what happens with time is these valves get worse and worse. They shrivel up more and more and more, and we end up with a bigger and bigger gap, and so we get more backflow, and that generally means we get increased congestion, and we start to get signs of heart failure. So that can be really what we start to see in most dogs, because it's the valve on the left side that's affected. We tend to find that we get a build-up of fluid back to the lungs. So generally what we get, excuse my very basic drawing, if we divide the heart up into its four sides, where we've got the left atrium, left ventricle, right atrium, and right ventricle. So basically from the left ventricle goes out to the body, goes back into the right side of the heart, and out to the lungs, and then basically follows that sort of circuit. So what happens when this valve is leaking is, instead of all the blood heading out this way, some of it starts to go backwards, and with time and with things getting more severe, we get more and more congestion of blood in this side of the bloodstream, and that creates more pressure back here in the lungs. And the lungs, basically, the blood vessels in the lungs are designed to leak a little bit, and that leakage creates fluid on the lungs, creates a cough, and we get signs of heart failure. So this is a condition that we can actually do a lot to manage the signs of heart failure, but we can't actually do a lot to treat the underlying endocardiosis. There's not a specific treatment for it. I mean, in people, a valve replacement is what would be needed. In dogs, what we're really looking at is making it as easy as possible for the heart to do its job. Now, up until a year and a half ago, our recommendations, or our belief, was that starting medication early in the process didn't lead to any better outcomes. So what the recommendation was is waiting until the dog developed a cough or signs of heart failure, and then we would start on the medications, which generally would work quite well, and really on average would give us maybe another 11 to 12 months of good quality of life before the heart condition progressed to the point where it was kind of causing significant problems and we couldn't control it medically. The advice now is that when we find a heart murmur, it's generally recommended that we look at doing a cardiac ultrasound. And what we're looking at with the ultrasound is we're looking at signs of the heart undergoing changes. And what the main changes that we're actually looking for is enlargement of the heart chambers, because what can happen is, as this blood is heading backwards the wrong way, gets a bit of an overload here as well, and so the chamber starts to stretch. So what's been found recently, there was a big trial called the EPIC trial, and it found that dogs which were started on medication as soon as they start to develop signs of cardiac enlargement did much better and had longer life expectancies, big delays in onset of clinical signs, and generally were much healthier dogs for longer. So what we now recommend do the ultrasound. If the ultrasound shows signs of cardiac enlargement, then we recommend starting on a medication. And that medication, it's called pimabendan, and it's in the class of drugs called phosphodiesterase inhibitors. Bit of a mouthful, but what it basically does a few things. It dilates the blood vessels leaving the heart, and so what that basically means is it's much easier for the heart to pump blood forward, so it goes in the right direction. It also helps the contraction of the heart, so it makes it a stronger contraction. And those factors tend to reverse a lot of this secondary change that we get in the heart. And so if we were to repeat that ultrasound a month or two down the track, the heart will look much more normal and be functioning much more normal. Because you can imagine a muscle, once it gets stretched, it's not as effective and can't contract as strongly. So we really want to get this heart back to a normal sort of shape and size. So that's the real basics of endocarditis. Actually, one more thing I should mention is the worst case scenario with endocarditis, where people go out in the morning and find their cavity has passed away. And what can happen with this condition is, as the valves shrivel, they can come back to one of these things I've drawn in green called the chordotendae. And as the valve shrivels, it hits the point where these chordotendae attach, and it breaks away. And so instead of having a leak which is this big, all of a sudden the leak becomes this big, and a lot of blood is going in the wrong direction. Now, if that process happens slowly, the dog can compensate and the body can adjust. But when things happen quite suddenly, the dog's not able to compensate effectively. The heart can't pump blood forward very well because a lot of it's just going backwards. And that's where the dogs can pass away in their sleep. It's not a painful thing to happen. So far as actual ways for pets to go, it's probably not a bad way, but it's just something we see sometimes. So I always warn people, if we've diagnosed their dog with endocardiosis, there's a very small chance they might go out in the morning and find their dog passed away. But if that happens, it's a painless way to go, and really is probably one of the nicer ways for dogs to go. But yeah, if your dog has got a heart murmur, if your vet finds a heart murmur in your dog, they may now recommend a cardiac ultrasound. They may or may not recommend medication based on the results of that. But this is something, like I say, we can give your dog good quality of life for quite a long time.